How do surgeons source and shape cartilage grafts for revision rhinoplasty? Imagine rebuilding a delicate sculpture with pieces from your own body. That's exactly what surgeons do when they source and shape cartilage grafts for revision rhinoplasty. They mainly use autologous cartilage, which means cartilage taken from the patient's own body. This approach reduces risks like rejection or infection and helps create a natural, long-lasting result. The first source is usually the nasal septum, the wall of cartilage dividing the nostrils. Since it's right inside the nose, it's easy for surgeons to access and provide strong, straight cartilage ideal for structural support. However, in revision cases, previous surgeries might have depleted the septal cartilage, so surgeons look for other options. The second source is ear cartilage, harvested from the conchal bowl, which is the curved part of the outer ear. Ear cartilage is more flexible and curved, making it perfect for smaller grafts or refining the nasal tip. The incision is hidden behind the ear, so scarring is minimal. Because ear cartilage is thinner and naturally curved, surgeons often layer or suture pieces together to add strength when needed. For larger or more complex reconstructions, especially when significant deformities or structural weaknesses exist, rib cartilage is often the best choice. Rib cartilage is abundant, sturdy, and can be shaped into larger grafts. It's especially useful for rebuilding collapsed nasal bridges or providing strong tip support. Harvesting rib cartilage is more invasive and requires careful technique to minimize discomfort and complications at the donor site. Once the cartilage is harvested, the surgeon carefully shapes it to match the desired nasal contours. This involves trimming it into thin slices, layering multiple pieces, or carving it into specific forms like shield grafts for tip support or dorsal onlay grafts for nasal bridge augmentation. Sometimes, cartilage is crushed or diced and wrapped in fascia, a thin connective tissue layer, to create a smooth, natural appearance and hide irregularities. An innovative technique involves shaping small septal cartilage pieces with a groove to fit over the septal angle, providing stable projection with minimal cartilage use, especially helpful when cartilage is limited. Surgeons consider many factors when choosing the source, including previous surgeries, cartilage quality, the extent of deformity, and functional needs like breathing support. They evaluate the nasal framework carefully to decide the best grafting plan. The grafts are secured with fine sutures to prevent shifting or warping over time, ensuring stability and symmetry. The ultimate goal is to restore both the aesthetic look and the functional integrity of the nose. In summary, cartilage grafts for revision rhinoplasty are mainly sourced from the septum, ear, or rib, each offering unique advantages. Surgeons meticulously shape and secure these grafts to rebuild the nose's structure, improve appearance, and support breathing. Using the patient's own tissue aligns with the safest and most effective practices in plastic surgery, providing natural, durable results. Always remember, each case is unique, so consulting a qualified surgeon is essential for personalized care.